Hello everyone, I am Dr. Khidr Mustafa Khidr and I am endodontist. I have more than 24 years experience in endodontics and also I have more than 9 years experience in microscope using in endodontics, and it is my daily work, every cases from A to Z.
During this presentation, I will focus on the microscope generally in dentistry, and I will focus more on the importance of dental operating microscope in endodontics. So, for more interested people or dentists, I will also discuss another topics, which is how the microscope is work, how we are do setting, and troubleshooting, which is a mechanical part of the microscope. And I will discuss some other details, which is very important for whom they are their interest about the magnification, because magnification, I am using a dental professional camera since 2010 or 11. So before that, I am using a magnification, which is a dental professional camera, but later on I will jump to the real magnification, which is dental operating microscope. So if we look around ourselves in dentistry, we found that the tools that we are using in dentistry, really they are small and tiny. And you see the blades, the forceps, even the mirrors, which is they are used for the endodontic microsurgery. So they are really small and tiny, and we need a magnification during these procedures. The endodontics file also they are a micro level, because for example this file, which is 20 tape per 6, the tip is 200 micron. So we know that dentistry is a micro medicine regarding the general medicine, but especially the endodontics it is a it's a micro medicine in the dentistry. So it is very important to pay attention about the magnification. So another specialty that they are dealing with the small tinies or small subjects or small tools, which is implant. You see that in this picture, this small implant. If we want to make a precision work, we need a magnification to have precision work. So all the dentistry, I believe that they need a kind of magnification, but it is different from one specialty to the other. Another point also what I want to show you also, in periodontology, also we need a magnification, and you see this microblade. If we are using this microblade, we need a magnification to do a precision flap and a precision work. So generally, the ways or the tools that are used for the magnification, they are the following. So first of all, today they innovate this tool, which is a camera inside the light. So maybe it's a kind of floor mounted type. So this way that they are using magnification uh, for to do a still image, to do a video recording, and mostly this kind of tools or way are used to motivate the patients for the cleaning of their mouth, for to tell them that you have a caries. But absolutely this kind of camera, they are not able to have inside the patient mouth, because it's not able to go inside like this dental operating microscope. So the second way is the professional camera. This tool is very nice to take high quality images, but it's not suitable to take a video recording inside the patient mouth. The other way, which is the intraoral camera, this is a simple tool and it's not expensive, but also they do updating in this tool, and they are able to take still image and video clips, but in a low quality. So it is a suitable way for just for diagnostic purpose and to motivate the patient. So there is difference between all these ways in the let's say in the way to have a benefit of it, or in the quality of their images and videos. The last way is the dental operating microscope. So the dental operating microscope is a very suitable tool for endodontics. So I focus more today on the dental operating microscope. So the first question is why we are using a dental operating microscope. After really my experience in endodontics, I found the following questions also interested by many endodontics or many articles or papers that I read on the net. So qualification or improvement of the managements, ergonomics, documentation, treatment plan, teaching, motivation of the patient, legal issue, marketing, patient satisfaction for treatment, or sometimes psychological status of the patient. So I found the following topics generally, and also I believed in my practical life. So I will focus on each one alone, and I will show you how much is important, because I believe that magnification can do amazing things in your life. So qualification of your work or of improvement of your management. I want to remember you that before I am using a microscope, I use a dental professional camera. So at that time I do a composite, but when I believe that we should use a magnification in dentistry, so I take a pictures for my composite restoration. Really, I shocked because I found gaps, something which is not believable. This tool, which is a kind of magnification, it will improve my quality of work or its treatment procedures. So qualification or improvement of your management is very, very important to be your consider, because if you want to update yourself and to upgrade yourself, you should use tools that improving your skill. So let me to take an example with you. So this case referred to my clinic, and after I take an X-ray, I see that this dentist, they are doing a very good coronal seal, but why they missed a canal? Why they do under obturation? So it tell me the story of this dentist. They go to the, let's say, a courses for the endodontics, and I will appreciate their effort, and I will motivate him to go to the courses, because they will upgrade himself by this way. But as they didn't have a tool, a suitable tool, they are not able to find an MB2. Okay, so this is important for them to use a magnification to see more and to do more, because we believe that if we see, we can do it. So after I take a picture, I found that regarding the previous X-ray, good coronal seal, I see that at the site of the MB2 there is a flowable composite that tell me this dentist also, they believe that coronal seal is important, so they do a good sealing, but they are not able to see the MB2. So I do removing with my ultrasonic tip the composite, and I found the dentin map or the site for the MB2 easily, because I have a magnification. And in the later slide, I will tell you about that, how we are not able to see with the naked eye, how we are able to see with the dental operating microscope. So I do finding the canal, following, shaping, cleaning, disinfection, and then obturation, and I finish the canal. But what I want to highlight in this case to you, that when I want to follow or to find the MB2, I am able to see the shadow of the MB2 in the microscope, in the dental operating microscope. But the tip of the size 10 endodontics file are difficult to go inside. It is tell me that this canal is tight, so it's not easy for the human being's eye to see this area, because it tell me that this canal is very small and very tiny, and I will later on tell you how much it is size. So I finish the case, and I tell the patient here the problem I find, and I obturate the case. And after the following up 24 and 84 hours, the patient said, now I am satisfied, I have no pain. So I would like to tell you some tricks or some important facts about this point, which is human eyes are not able to see MB2. So if we want to find an MB2 with a naked eye, it's only about 44% of cases. But I believe that because I do research with my colleague in my country, that the percentage of MB2 in our society randomly is more than 80%. But today we say, and we believe that all the cases they have MB2, but we are not able to find it, because this measurement or this numbers tell us in this article, and as my practical, it is true, because some dentists intend my basic and advanced course. So in the basic, I will tell him that using of magnification is very important So when they attend to then the advanced one, because in the advanced one they are working with the dental operating microscope, but in the basic one, we'll tell him it's your option in this course to use a microscope or to use a dental loop. So in the next course, he said that, Doctor, thank you very much for your recommendation. Today I find more MB2 in my cases. I know why, because we are using a magnification. So if I want to find MB2 with the loop 2.5x, the percent is 56. With the loops 3.4 x, it is 46. With the microscope 8.5, the magnification is 72. With the 21x, it is 84%. So still unidentified cases of MB2 is huge, which is 16 according to this research. So I believe that this is true and this is fact, because many cases refer to me, and they have experience about maybe 5 or sometimes 10 years of in dentistry, and still they missed the MB2. So the second point which I want to focus, which is ergonomics. So ergonomics is very important topics, because also I want to remember my let's say my life in before I am using a dental operating microscope. Really, I get disturbed in my sleep and I have a neck pain, and after that I decide to use a dental operating microscope, and I can get sleep later on, very relaxed sleep, but I need about maybe 2 to 3 months until I rehabilitate my neck muscle. But when I using a microscope, this is amazing tool that make me more relaxed and more satisfied with my treatment procedures. So I do a research, and in order to, what's meaning ergonomics, how much is important from, let's say, from the other angles, because I believe that, because this is my life. During my life I I realized this fact, which is how much it will help me to treat my neck pain. So they said that ergonomics is a science of maximizing human performance, or it is a study of both human excellence and health. And physical ergonomics, it is a study of motion, efficiency, workplace design, repetitive motion, dynamics, workplace safety, and long-term physical health. Cognitive ergonomics is mean examines the issue of performance as they relate to teamwork, career burnout, stress reduction, effective training of team member, consistency of skillfulness, and organizational culture. So really, this is all these are true, because after I use a microscope in my life, I qualified my work, I increase my outcome, financial, or also I get more. Let's say I treat the cases in the dental case in less time, so it is a time saving way also. So also my team with me in my clinics now it's more satisfied, because um, they are getting upright position, and they can easily, because there is a monitor, they can see where they put the suction tips, whatever the tools. So what I want to highlight again, which is what's meaning ergonomics, it is ergo and nomics. So ergo it's mean work, and nomics it's mean natural laws. So if we pay attention about the ergonomics, if we are a designer, so we design tools in a way that it will work in a natural laws with the human beings, to get more satisfaction and more outcome and better health. So I want to focus on two important points about the ergonomics, which is NAIC regarding the endodontist, because I'm endodontist, and I focus more on this specialty, but still the magnification is important for all dentistry. So the neck pain is one of the important topics that should be considered. So how the magnification will solve the problem, and which kind of magnification is better. The other point is that eyes, human eyes they have a limited power and limited ability to see the small or tiny objects. So in this topics, I will focus on this two important points. So I will return back you to my clinic in order to, because I am a clinician, Besides that, I'm a speaker, endodontic speaker. So I will show you my tools in my clinic, which is loops that I have. But we should know that now I am not using a loop for the endodontics procedure. I am just sometimes using for the play application of the isolation or rubber dam or some other very simple procedure, because I believe that I should use in all cases daily using, and from A to Z. It means I am using 100% of in all my cases. So I bring a forex loop, which is a standard loop for the endodontics, because it is a fact that when we believe to use a magnification, we should start at least with the forex loop. So I will tell my team to take a pictures. Here in this case, I am using all my tools, dental chairs tools, in a scientific way, in a correct position, to have let's say a good position, and I focus on the upper six. I found that I do bending for my neck in this way. So I believe it before many years about it, because now I am using a dental operating microscope, but I want just to show you how much it will affect on our position. Unfortunately, I found some pictures in the net. They take a pictures, snaps, to tell the peoples that we are using, that we are treating cases without anything. You see, there's no loop. So this, with my all respect to all these cases, all peoples, but I want, from the scientific view point, that in this case, they are not able to see inside the patient mouth. So they are just make a general looking to the external patient's mouth, or only the anterior teeth. Because if they want to see inside, they should close up her head to see more, because closing up of this her head, it's a kind of magnification, but it's wrong. It's absolutely a fatal mistake, because when we closing up our head to patient mouth, we are subjecting ourselves 100% to cross infection. Another pictures that it is a kind of branding of a loop, and I motivate people to use or dentists to use a magnification. So here, without the loop, it is a reality, it is real, and when they are using a loop here, they do correcting of their position, very nice, okay, but still a kind of bending of their neck, or not able to control everything. So I take a picture in our colleagues in our hospital in a governorate part. So, but later after I take a picture, because I am a head department of the endodontics in our special center. So I will take a picture, and I will tell her, my colleague, you see, you are subjecting yourself to cross infection 100%, and you are doing some bending of your posture in a wrong way. So I will tell her that it is normal to share this picture in my lectures. He said yes. So I present this case to show you that many dentists works in this way. So then I will jump to the other kind of my magnification, which is a customized TTL loop. So it's 3.2. Here, as it is customized and they have better working distance, it's more than 45 and less than 50. It's between 45 and 50 centimeters of working distance. So it will help me to correct my posture, okay, better than the previous one, which is a 4x prismatic loop. But still I do bending my head, and this is lead to in a long time to physical disorder. Then I will take another shoot with the dental operating microscope, and here it is from scientific view, it is I do upright my head and I am very relaxed. Still I am focusing in all our previous tool on the upper six. Okay, so my head is relaxed, my neck, my back, my leg, my thighs, and I see very clearly and satisfied, and I can do for not only a minute, or maybe more than hours or 2 hours, without I feel fatigue in my muscles. I would like also to motivate you to use not only the dental operating microscope to get relaxed in your work, or to have a scientific posture during treatment procedure, but also the this doctor's tool, which is a new update one, you see, it will bend their self with my neck, or with my back, and with my shoulders, or my posture, to have a very good position with me. And also the dental chair, you should choose a dental chair which is ergonomic design. So this two stool and this dental chair also, they have ergonomic design. So what I want to tell you, that the previous slide tell us that if we because I do too much research in the articles about the physical disorders of the dentist, so I take these numbers from the scientific websites, and I do this animation, or I do this diagram to you, to show you that when we have a zero, or we are using a dental operating microscope, or we are just uprighting our head, so it's about 5 kilogram of the force on our necks and muscles. So if we bend it 15, it is 12 kilogram. If we bend ourselves to 30, it's about 18 kilogram. If we bend ourselves to 45, it is about 22 milligram. Do you remember the previous picture that I will show you? So the dentists, they do bending 45 degrees, so they have a force or tension on their neck and muscles about 22 milligrams. So it is huge. Absolutely, it leads to a physical disorder. So the let's say the surprise is that the companies today, they are do a kind of loops that they have bended, or they have a prisma inside. They can so the dentists are able to not bend them the head. So it's a kind of solution, but still we have a problem. I know that this is in the market and this is very nice, but still are not able to replace the dental operating microscope, because I will tell you later. So here we are solving a bending of our head and maybe other point. So let me just to comparing the dental loop about the other problem, which is not only bending, which is when we are using loops, our eyes and our neck also get, let's say, tension. So the other point is that uh, we are not looking in the loop in a straight or in a parallel way like the dental operating microscope. So we get strain on eye muscles at least. So we have in the loop neck pain, eye strain, and other important, which is the magnification. So we have limited numbers in the magnification. Also, the companies they produce more and more magnification, and also they produce more and more complication, because using of more magnification, they will produce more complication also. So let me show you another things new in the market, which is in the previous loop. Today they updated their loop, and they are not only uprighting or making the prisma or bending, but also they turning to inside, so in order to make it parallel. Okay, so and today we are able to use a loop in a straight and in a parallel way. Also they have up to sorry, to 10x. So, but what is the problem with that? If we are using, we say we are not using the dental operating microscope because the loops are able to replace this magnification. Really, there is other thing which is very very important. First of all, it is magnification. So the loops traditionally they have about 3.5, this kind of loop, which is better than the prismatic one. But as I say again, today they have 10x loops. So if we look to the 10x loop, we know that here the image of 10x. So we are able to see the MB2. We are able to see the MB2. But the problem is not only with the let's say magnification. So if we are using 10x, what happened? With the dental operating microscope, it is very very easy to use from 2.3 up to 40 or to 40x. But the problem with the loops regarding the microscope is that when we are using more magnification in the dental loop, we need a bright light. So it's not easy to produce that. Also, the company solved this problem today. We have a LED light, which is light emitted dye, small and tiny. We can use it over the loop and we have a light. But the other problem is that what I found in my practical, then when we are using more magnification, we face this problem with heartbeats. When we have a heartbeats, we feel that the picture will, let's say, have a movement. So we are not able to control that. So how much we are increasing the magnification, the movement of the patients, or the heartbeat of the patient, or the heartbeat of the practitioner or the dentist, are clear inside the magnification, but with the dental microscope stable. So with the loop, it's not stable. With the dental operating microscope, it is more magnification, better light, and it is stable. So still, the using of the dental operating microscope is superior than the using of dental loops. So the other point is documentation. So documentation became a vital part in our life, because you can easily tell or record your cases. Simply, you can take a preoperative, and during the caries carization, to tell your client that you have caries there and there, and you are doing cleaning for him. And when you showing final results of caries lesion after cleaning, the patient will become very realized about that they have inside their tooth. Okay, so this is not able or not easy with the other tools. So with the microscope, it's very easy. Still, with the dental loops are not able to do that. So the dental operating microscope is superior to the loop from this point also. So it's not only about the parallel or bending or some. So with the dental microscope, we are able to do many things which is not able with the dental loops. Maybe the science do solving this problem also, but today it's not not able with the loop. Only with the dental operating microscope we can do that. So the fourth point is the treatment plan. So really, magnification can change or the treatment plan. Sometimes we decide to do something when we see inside the magnification, we are not able to do that. Sometimes we decide to do something, not to do something. Sorry, in the treatment plan we can, with the magnification, we are able to do that. So it is an amazing tool to design the treatment plan or to change the treatment plan, or it will make us to change the treatment plan. Let me to show you this case. Here, this case came to me, to my clinic, and I will take a radiograph. Then I do cleaning of the caries lesion. Let me to tell you that when I see amalgam inside the inside the tooth, mostly I know that there will be mostly rare, in a very rare case, we are not seeing the crack. Here we have a case reached to the pulp. The case need root canal therapy, but I know that I have a background. Sometime when I have such a cases, I have a crack. Maybe this is crack go to inside the root. So I tell the patient we are not able to do root canal because we cannot see this crack in a traditional way. Maybe other dentists who they are not using the magnification, he said that it is easy to do a root canal and it's treatable, but they didn't know that there is a crack. So I will clean and I will check. I will find that the crack is only in the coronal part of the tooth. Unfortunately, it's not reached to the root. So it is, from scientific point, it is treatable. And I show the patient, here you have a crack, and the crack is in the coronal part. We are doing a root canal therapy. And I take a post-operative, and here I have a pre and a post, and I advise really the patient to wait at least about 2 to 6 months. Maybe 2 months is enough, but 2 to 3 months is very nice. But some cases, maybe for other subject or issue, I told him to wait about 6 months. If I found any sign of failure, I tell him not to do crowning. But at the beginning, I told the patient that as you have a crack, it's mandatory to do a crown for the tooth. But I advise him to wait at least 2 months or 3 months to have, let's say, a post-operative or follow-up for the case. If I have no problem, maybe this crack go inside and we are not able to see more. So if the case is stable, we motivate him to do a kind of crown, which is sometime endo crown, sometime full crown. So the other point is teaching. So if you are interested to do a teaching for your students, for your colleagues, for in your courses, so it's very easy to tell them. So to take a pick also an example. So I have this case. Before I touching the case, I take a picture, and I can easily say to my colleagues, such a cases before I touch, I know it's not easy to make isolation there because we have a gingival polyp. So in this way, I should remove it. Then I will I can able to do isolation easy. So in this way, so maybe they ask how we can remove this polyp. So there are many ways. I can easily say that with the cautery, only with a seconds, I am able to do a cleaning of this area. So I put the rubber dam, and you see it is very, very nice isolation. Another thing that I see after I remove the composite, I see that they do a ditch for the case, or there is overhang of the composite. I remove completely, then I do cleaning, root canal therapy, and then I do composite or final coronosis. So in this way, we are able to do or to teach very easily. Motivation of the patient is another point. Here the cases I want to show you. This case came to my clinic, and I advised him before weeks because sometime when I have a case, I see that there's a plaque. I tell the patient that why you are not doing a good brushing. He said that I do a good brushing, but when I take a picture, okay, when I take a picture and I just let's say do a very, very touching with the whatever the kind of photo editing, I increase the saturation, decrease the exposure, so the oedemated gingiva will appear more clear, and all the plaque, it is clear well. Here we have a hypocalcified, here we have a plaque, here we have oedemated gingiva. So when the patients are let's say see this case, this situation, he absolutely motivate and they do good brushing. So this possible with the dental professional camera, but with the microscope is very, very easy because I can take a close-up picture also for the patients with the dental operating microscope. Directly they can see what happens in their mouth. Also we can take let's say a short clip, and I tell him, he say that I do brushing good, or I do brushing in a correct way, and I show him that here the plaque, and if you are able to do a good brushing, why you are leaving this amount of plaque on your anterior teeth despite the posterior that retained more plaque. So it's very, very easy to motivate the patient if you have a dental operating microscope. Another thing which is legal issue, our country is like other countries. Sometimes people complain about something maybe not clear for them. He said, for example, let me show you this case again, that if I do composite, the patient only they are see in the mirror this caries, but after I do opening or I do cavity, I see this caries also. But before I touch the case, I tell when we open a class 2, because it is something inspected that we have food impaction, so mostly this tooth also is get caries. So when I tell the patient that if we open this cavity and we see the caries in other tooth, it is did you give me a green light to complete the case, or what's your decision? So some people are not let's say pay attention about this point, and later on he said, why you are doing one composite, now you are doing another one. So you can see, or you can show him these pictures. Here you have a caries, and I will take a permission at the beginning. So it is a kind of protection you legally. So it's very, very easy from with the using of the dental operating microscope to take a still image in a second. No need time, just during the work, tuck, 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 or click, click, click. You can take a picture or a video. So the other point is the marketing. The marketing is another issue today because the society became large and large, and the social media and the let's say the technology became a way to do a marketing. So marketing is very important point for me. Is maybe I regard it is a holy point because marketing is not only cheating. Absolutely, it's wrong. Unfortunately, some peoples they believe it or they set their mind that marketing it is cheating of the patient. No, marketing is a holy status and it's a holy thing, and we can do amazing let's say thing with the marketing. So let me show you something. When I post such a picture in my social media or I share with my friend in my courses, they know that I do organize my clinic in a beautiful way and in a clean way, in an organized way, and the patients can easily read that we are doing very good sterilization in a scientific way. All these material they are pouched, so you are, let's say, tell the patient that you should trust us because we believe it in our job. We are doing in a scientific way. So we can easily share our cases because I can easily document, click picture, click video, and I can share with my peoples, with my society, my activities. So it's a kind, here I do marketing for my, let's say, for my work, and then here I do marketing for my scientific work. And this is the way that we can tell the patient other important thing, which is if you show in your social media that you are able, that you are doing file separation removal. So removing of the file separation, it is a service. So not people are believe that this tooth is treatable, and some people believe that this is make a CA, unfortunately. But when you tell them that it's treatable, it's not something complication. So it's very important to tell him that we are doing or we have this kind of service. So the last thing what I want to share with you is the patient satisfaction for treatment, because many times people said when the patient came to my clinic or client came to my clinic, he said that I see in your Instagram, I see in your social media that you are using new tools. So I'm very satisfied to this because I can see or I can your ability or your update tools or whatever your let's say treatment procedure that you are using. I love this way of treatment. So I came also to have this kind of treatment. So I can easily purchase or share with my society, with my colleagues, my clinics in order to make the patient more satisfied. So here I want to focus here this follower with the patient look to the screen and he see that what I do, and later on this follower or the patient said again, this client said that I love your work, you are doing very nice, very clean. So also I have a problem in my mouth, I have a tooth decay, I have, let's say, whatever the problem, and I want to treat myself in your clinic or your center. So this is a very easy way to tell the people or to make the people satisfied with, because they see what you are doing. Another point, it's not only the followers of the patients, the patient himself, they can see what we are doing for them. You see, he directly see the screen in the ceiling, so they became very satisfied because they see what we do. So also it is easy with the dental operating microscope because we have a direct video stream, and we tell him and we take a permission from the patient that we are doing, if you want, a video recording for you during the treatment procedure and still image, and it is patient's option to send him through the WhatsApp or any kind of social media applications, the pictures for them. So another topic, which is importance of dental operating microscope in endodontics. This is important for me to tell you some very important facts about what's happened inside the endodonts or inside the dentistry. So let me to share with you some important facts in the life. They said that the human hair is about 70 micron, and human cell is about 25 micron. Bacteria is about 1 micron. And you know, I am a practical and I love technology, so I bring a size 80 endodontics from quality brand, and I compared. So here you see it is clear that this is 80 micron, which is size 80, and here you see it is a little bit smaller, so I believe that this is true number. This is just to make you satisfied that this is fact, that we are dealing with the micro things, because I want to show you also another important things, that human eyes, also this is the fact that babies can see less than 200 micron, because adult one, or they said that in other ways, they said that the human beings are able to see 200 microns, but the babies are able to see less, about maybe 100 micron. It is about the working distance is about 7 centimeters, because the babies are able to focus or to see a sharp image in 7 centimeters. But adult human are able to see 200 microns in about 70 and 25 centimeters. Because if they want to close up their eyes more, the pictures became blurred. With the dental loops 2.5, we are able to see 100 micron. With the 4x, we are able to see 50 microns. With the 3.2, this is the working distance of the dental loops. So we are able to see with the 4x 50 microns, but the working distance is 32, which is small one. 42, it is regular. 50 centimeter, it is for the people who they want to work in a large working distance. But this means that you are not able, because this tool, they have a fixed working distance. If you close up your head more, you are not seeing, you see a blurred image. But with the microscope, the story is different. So we have many options. So we have 8x magnification, where you can see 25 micron. 10x, you can see 20 microns. 20x, you can see 10 microns. 25, you can see 5 microns with a variable working distance. So you can see in 19 centimeters up to 46 centimeter. I will later show you in the later slides. So let me show you an example in my practical life. For example, here we have upper 6 molar, and the case is referred to me because the patient have a pain again. And you see that I am using a size 10 until I catch the file. So it is mean that the size of the this orifice of the canal is 100 micron. If we go back to the previous slide, we know that human eyes are able to see 200 microns. So it is normal to not see the MB2, and this is the cause, or this is make that most of the dentists that are not using the dental operating microscope, they are not able to see the MB2. I know that there is other rule to tell to show you, or to see the, let's say, the site of the MB2. For example, we can just make a line from MB to palatal, then from the DB to this line, imagine, and the dentin map. Many ways, because you see here the dentin map is clear. Here the extension, it means that there is an MB2. All these are true, but the main issue is that with the magnification we can see more. So let me show you another thing which is more interest. It is using of the or size 8 in this case. Here really I am not able to catch the orifice of the canal with size 10. I'm catching the orifice with size 8T, which is 80 micron. So many times I have cases that the orifice of the canal is less than 100 micron. It's 80. It is 60 because I am using a tip of 60 to catch the canal. So let me show you something which is also in my clinic. Here I have a case. They refer to me because they do file separation inside. After I take a picture, I know that there is more than one pieces inside the tooth, and they do many problem in this case, really. Okay, so they send it to me to solve the problem. So I realized that after I just remove half of the TF, there is a bleeding, and I know that there is a perforation, So I remove all the TF. And I found that there is perforation. And the dentist really sent me a message that, doctor, when I do this complication, let's say I get lost. I don't know what I do. So they are not able to see the canals. So I do just cleaning for the area with the sodium hypochlorite. I put a Teflon to stop the bleeding. Then I find the MB2. I clean the canals. Then I shape. I shape all the canal, especially the palatal, the MB2. Then I close the previous canal, MB palatal, and I realize that there is here they do a perforation and here they do a perforation. So what I want to tell you that here I see that there is 2 points of perforation, as I say again. So here the perforation, here the fracture instrument, here the stomacal canal. So you see I do sealing for the previous canal. Now I find or clean the area for the perforation. I put the resorbable sponge, and here there is no need to do that. Then under the microscope, I seal the area with a MTA after I pack, and here I should pack and seal the MTA to the clean walls, which I do cleaning and disinfection. Then I put a layer of the MTA liqueur type. So this is I can say that it is possible even with the loose, but absolutely with the dental operating microscope, it is amazing, because when you test it with the dental operating microscope, you are able to deal with the 20 microns, but with the loops, not. So this is tell us how much it's easy to control such complications that happen. Then I jump to the other point, which is the removal of the separated file. After I do sealing for the perforated side, I just touch or a little bit trough around the file. I remove it. So without the dental operating microscope, it's not easy to remove the separated file. Even in the coronal part, but in the coronal, maybe with the loop it's possible, but absolutely in the middle and the apical part it's not possible. But with the coronal part, still the other point, which is precision work. So we maybe without the dental operating microscope, we are doing another perforation. So you see that I removed two separated file, here the first piece, here the second piece. So I finished the case, I shaped the distal canal also, and here you see that the area for the perforation repair is very clear after I do obturation. Then I put a coronal seal and then the final coronal seal. So here the preoperative and here the postoperative, and you can see the area of the perforations, the good sealing of the tooth, and it is all because we are using a dental operating microscope or a magnification. We are able easy to control the case and manage the cases or complications. So the other topic what I want to show you or to highlight is the position of the dentist and assistant regarding the dental operating microscope. It is one of the questions that many times asking me. that which is the better position or the place for the, you see here the clock, and here the dental chair, here the assistant. So assistant are able to move around this area, but the dentist, some people are prefer to sit or here the position. Some people, some other dentists are prefer this position, other one this. For me, mostly I am sitting between 9 and 10, 9 and 10. In some small rare cases, I have a 12 o'clock position. But it is important for the people who they are using at the beginning, so really they are not able to control the case, so they're asking this question. So it's important slide, but it's not too, they have too much information. So this is the main information about this slide. Another topic which is important, which is let's say directly related to the dental operating microscope, it is introduction to dental operating microscope. So we have many options or many mounting method for the dental operating microscope, and I will show you which is one is better. Okay, so you have a ceiling mounted, we have a wall mounted, we have a ground mounted, we have a table mounted, we have a dental chair mounted. The best one really is the ceiling mounted, because I found that it is available continuously, because I see many years ago for some famous dentists who they are working with the aesthetic dentistry. He said that we are using a dental professional camera. So one of the points that should be considered is that the dental professional camera should be in your clinic on the table, not be behind the table, because if it's not in between your hand, it's not able to use it every day or every time. So the using of the other type of microscope, for example the floor one, after I do research in my country, I found that all the dentists that they have a dental operating microscope they are not using daily. They are not daily user. He said that it's not easy. It's not easy to bring every time to the patient his, so it's not easy available. So the best one is the ceiling one. I motivate and tell to my colleague, if you want to purchase a microscope, please choose the ceiling one. So this one is very stable. This one is not stable too much. And this is that the wall mount is only indicate for cases that they have a limited area space in his clinic, and they are not able to make a new design of their clinic, so they are restricted or limited with to choose the wall mounted type. And the final one, which is the dental chair, is not recommended, because this is stable, this is not stable easily. So I don't try to use this one and spend money with this one. The other point is one, as I say again, is stability. So you should have a microscope which is stable every time and available every time, slim in size as much as possible. So this is take a space in your clinic. So it's not easy in motion, this one. So it's easy in motion. So it is here we can do accessible accessories. So because you have wires or the connections, not easy with this one, it's easy with this one. So all these properties is available in the ceiling type. So it should be available continuously, stable, not vibrating, slim in size, easy in motion, easy in using, and they should have acceptable accessories. So the accessories need connections, weight, space. So with the ceiling one, it's possible. So let me to go to other important point, which is directly we are dealing with the microscope. So what is the parts or components of the dental operating microscope? Generally, we have a primary arm, and we have a secondary arm, we have a balancing arm. This arm is very important to be known, because when we say that, for example, the primary arm should be loose or the secondary arm should be not loose, you understand what I say. So the other component is the eyepiece. When you have a microscope, dental operating microscope, try to use a eyepiece which is they have a high number, which is 12.5x. Also, they should have a high number of diopter. So today in the market, plus minus 7 is the most famous one in the market. So try, when you choose a microscope, to have the eyepiece, Y filled eyepiece with a high number of diopter, because diopter is something is important for the people who complain about some defect in their eye. So we can just regulate with the minusing or plusing or the diopter, or changing or rotating the diopter. Another component is the IPD regulator. Here we are as a very elegant, and we should use a dental operating microscope that they have a changeable IPD regulators. So it's important to pay attention about this also. Rotation, the changeable binocular, because if it is stable, because I remember at the beginning I am using a dental operating microscope with a fixed inclinable binocular, but it's important to be a changeable one. Rotation ring is important because with the rotation ring we can make a pendulum action. So sometimes I change or rotate a little bit head of the patient to right or to the left, but I just rotating the rotation ring, I can make a horizontal uprighting of the eyepieces. So it's very important all these accessories or components should have in your microscope. Beam splitter is important for people who they are using another kind of, or for example, they are using assistant part eyepieces, or they want to use a mobile phone adapter or DSL camera. But I believe that this kind of camera is better because it is updated, it is slim, small. So I don't motivate or advise to use a external camera as much as possible. So we have here we have integrated camera. As I say again, it is very important to use this one because it is integrated, no space, slim and easy to control. So here we have a zooming knob in this microscope. This my microscope. I am using a continuous one, not the step one. The first microscope that I used at that time, I have a step one. Some people preferring the step one, but continuously is much more advanced. And variable objective lens. The objective lens is you should have a high one number because the objective lens is the tool that they will capture the image, and they should have enough space to take a picture from the patient. I will show you now more and more detail about that. So the light source, here we have this knob that it will regulate the light intensity, change the filter. So it's one of the, they named as a multifunction knob. So maybe another dental operating microscope have other knob or other function, or they have more function in the same knob. It is up to you. It's the kind or the brand that you choose it. So we have iris diaphragm. This iris diaphragm is important tool or important component of the microscope. Iris diaphragm, it will increase the depth of focusing. In the same way, it will reducing the intensity of the light on your eye by 50%. I'm talking about this microscope because it is my microscope in my clinic. So if I want more light, especially when I go inside the canal, when I remove the fracture instrument, I increase the light because my microscope is default on 30%. So it will not hurt my eyes because it's not 100% full intensity. When I turn on my microscope, it will give me 30%. And it is quite enough for all the procedures. Only in case I want to file a removal, I need to a little bit increase the light, and in this case the light may affect or may hazard my eyes. So I will turn on the iris diaphragm, so it will reduce the light on my eye only, and it will not affect on the object. The object still became clear. So another here we have screen. So information display screen is for me is important because every time I know what's my zooming number and what's my intensity of the light and what's my filter that I use it. So it is a kind of, let's say, luxury component, but if it's not present, it's not mean that the microscope is not useful. So for me, it is a good option. Another tool is the handles. The handle should be ergonomic as much as possible. Here we have an ergonomic design of this microscope. By one hand, I can control everything. Another component is the screws, which is loosening or tightening screw. It's responsible for the loosening and tightening of the hinges or the primary, secondary, and the balancing arm. What I'm talking at the beginning of the slide. Another screw is the balancing screw. The balancing screw are responsible to balance the arm, not loosening and tightening of the arm. It is all about the balancing of the arm without pay attention about the losing. For example, if I lose this screw, still the balancing screw, it is stabling or making the arm in the same position. But the balancing the tightening screw, it will make is loose or tight. So the screw is important. The screw is to be have in your microscope. Let me to go to the another topic, which is how the microscope is work. So the microscope is work in this way. So we have objective lens. So the objective lens is responsible to capture the image and to give the zooming part. The zooming part, it will make zooming, and through the prisma it will give your eye, but the picture here is small. So the zooming eye, which is 12.5x, so it will maximize again and it will give you the picture. So this is the way that we are dealing with the object and we can see. So for the objective lens, as I say again, if it is a low number, it's not good, but if we should have a high number. Here in this microscope, I have a 190 millimeter to 460 millimeter. So the area which is focused, it is about 270 millimeter. It is very, very nice. So you should pay attention about this issue. Magnification, as I say again, my microscope is continuous. They are able to maximize or magnify 4x to 25, and I can stop between each numbers. So it's not step. So the step one, it will, for example, when you change to 4x, you are not able to see more. You should change to, for example, 6x, 10x, 16, 20, 25. It's up to you, but it is limited, so you have a limited number. Let me to go to, for people who are more interested about the microscope, to go to the other topic, which is how to choose a dental operating microscope. So it's very important topics. It is not difficult, but today after I do research, also I found that these four topics is important, and based on my experience, absolutely, because I have more than 9 years experience with the dental operating microscope. There are many brands in the market, and we can say that lenses, light sources, ergonomicity, and imaging are main items or important point in the microscope should be considered during purchasing a microscope. So there are many brands in the market. It's up to you to choose which one of them. But these points should be considered during purchasing. So they should have good or high quality lenses, high quality sources, light source, high quality or good ergonomicity, and or suitable or high quality imaging part. Okay, so let me discuss very simply each of these. So about the lenses we have objective lens. So as much as possible, try to choose the high number. Here we have 190 to 460. This is my microscope also again. So we have depth of focus about 240. So the objective lens, also we have a fine focus manually. So here we have a zooming system, continuous. We have a continuous zoom, and we have a step one. I motivate and I advise you to choose the continuous one, continuous zooming. So in eyepiece, try to choose 12.5x and at least you should choose a plus minus 7D. So you should have a wide field. About the beam splitter or the accessories, I prefer to use a integrated camera, not the, let's say, the external camera. And finally we have lenses, which is the prisma. So all these parts, they contain or they have lenses or glass inside. So we should choose a high quality company, because it will give you a sharp, bright image. So other point which is important, it is the light source. We have in the wavelength, we have only a limited area that the human being are able to see. So it is located in this area. So under we have ultraviolet, so we have radio. So the area which human being are able to see, it is the 400 microns, nanometers, till 700. So this is general information for us to know, but the other important point is that when we buy a microscope or choose or purchase a microscope, it's very important that we have three kinds of light source in our microscope. So we have a halogen one, so we have another kind, we have a xenon, we have a LED type. So if I purchase a microscope, I never motivate or advise any dentist to choose a microscope that they have a halogen light source, because it's not useful now. Because when you want to see, you are not able to see clearly. When you take a picture, you should edit your picture or set your microscope in a way that deal with this kind of light. So it's not easy. The best one is the xenon, but it is expensive, and they have a short shelf life or alive duration, so you should replace it, and it's expensive. The best one today, which is standard, which is a light emitted diode. So I choose this picture because I'm not able to find a picture really that will show me a pictures or images with the light, this three kind light. So I find this in cars. So we hear the image of the car with the halogen, with the xenon, with the LED light. So it is the same for the microscope. So I will advise you to choose the LED one. Okay. So about the imaging part, which is the final point in our this let's say part of a presentation, because I am talking about the ergonomics at the beginning, that the dental operating microscope is the best choice or option or for the dentist to pay attention about the ergonomicity, about the physical disorders. So imaging, it is a very important today's topic, because when we choose a microscope and we are not able to choose a good one, we may spend some money which is not useful. So we have four ways to make imaging today's. We have a CCD camera. Before 1 decade, the CCD camera are only able to make a direct video transferring. But today the companies, they are doing a CCD camera, that are able to do still image, video recording, and also a kind of setting of the camera. And we have another way, which is a single reference or professional camera, digital lens single reflectors. So this is a very nice choice for some people who want to use this one. But the problem or disadvantage with this tool is that it is heavy, and it is take a space from the dental operating microscope. The other way is the mobile, for people who they want to make a direct access to the social media, but it's not a good way, because here we have a limited memory. It's not easy every time to delete and to format your storage. So this one is very good. This one is good, but also this one will take a space, so it's not slim. So the best really option for the using of imaging tools, it is the built integrated camera. In my microscope, I have a 4K camera that it is very or fully adjustable, fully setting with only using a mouse. You have a beautiful data base inside my monitor, so I can use a mouse to regulate or to set the camera as much as possible like the professional cameras. So I motivate or advise anyone who want to buy or to purchase a dental operating microscope to choose a integrated one, not the external or the mobile one. But it's up to you. But this is my experience that integrate is the best one. So in the imaging, there are 4 points very important to have in your microscope, which is the imaging tools that you want to use. They are able to take a still image and video recording and direct video in a high quality. So the resolution should be at least full HD or more, but less than is not recommended. Also, I not prefer a 4K video recording. Full HD is quite enough, but not less than full HD is recommended. So also they should have easy control for the setting, and they should have also easy dealing with the data, because sometimes, as if you remember the previous slide, that dealing with the data in the mobile phone is not easy, because you should remove because your storage is limited. So the final topic is about the dental operating microscope setting. It is important for anyone to purchase a microscope. They should insist with the company that they tell you or teach you about how to do setting, how to deal with the troubleshooting. So the following video that I do, it is about the how to do setting for the microscope.
I'm going to talking about how to control mechanical movement of the microscope, then how to set the microscope, then troubleshooting for some troubles that happen during using of the microscope. First of all, we know that this is the primary arm, this is the secondary arm, and this is the balancing arm. So about the primary arm, this screw is responsible for the control of the horizontal movement of the microscope. So when I tighten the screw, the microscope will lock, and it depends on you how much you want to be the loose this the arm. So you may make it tight or loose. Then this screw is responsible for the movement of the secondary arm. So we have horizontal movement of the secondary arm. So this screw is responsible for the tightening and loosening of this arm. Then we have another movement in this arm, which is up and down movement. So there is screw, then I will talk about, which is responsible for the balancing of this arm. But this screw, as I say again, is responsible for the movement of horizontal movement of the secondary arm. Then this screw is responsible for the tightening and loosening of the vertical movement of the secondary arm. So I can lock it, okay, or I can make it loose. Then the final screw in the arms is the screw which is responsible for the rotation of the balancing arm. This screw is responsible for that. Then we are going to talking about the movement of the head of the microscope. So we have a lateral movement or rotation. This screw is responsible for the tightening and loosening of this arm. Now I lock it, so it is locked. Or I can lose it, so it became very loose. So you can tighten a little bit to become as you want to be. Then this screw is responsible for the balancing of the rotation. I will talking about that later. Also we have the movement of the head. So we have anterior posterior rotation of the head. This screw is responsible for the rotation of the head anteriorly and posteriorly. So if you lose it, it became loose. If you tighten, it became tight. Okay, so we have lateral rotation, which is responsible by this or tightened by this screw, and anterior posterior rotation that is controlled by this screw. This is the first part. This is the second episode. I am talking about balancing of the head of the microscope, then balancing of the secondary arm vertically. So about the head of the microscope, which is responsible for the balancing rotation laterally, is the screw, which is a balancing screw. So tightening anti-clockwise, for example, make the microscope tilted to the left, to the right, sorry, and tightening the screw in the clockwise make it the microscope to be tilted to the left. So why would they do that? Just to make the head of the microscope to be balanced in case we are putting a camera, external camera, or a mobile, so the change will happen for the head of the microscope. So by this screw, we can make a balance of the head of the microscope laterally. And the screw which is responsible for the anterior and posterior is this screw. So by tightening in the anti-clockwise, for example, the head of the microscope will tilted anteriorly. In an anti-clockwise, so the head is tilted, to the posteriorly. Okay, so this is responsible for the balancing for the anterior and posterior rotation of the head of the microscope. Finally, we have the secondary arm movement. So the microscope, when we are losing the screw, this arm should be balanced. Okay, so the dentist, if they want the microscope to stop in this position, it should be stable. And we have this screw. Okay, we just remove this screw cap, and inside we have a screw by LNG spanner or screwdriver. We can rotate it clockwise to make it vertically, or anti-clockwise to make it down. So this is about the balancing of the secondary arm and the head of the microscope. I would like to talk about how to set the microscope. I mean by the setting is that not all dentists, they have both eyes in the same power. So they have one dominant and the other is recessive. So in order to make the pictures that we are looking to it in the screen and in the dentist eye or in the viewfinder, the same sharp image, we just follow these guidelines. Very, very easy. First of all, try to put something like this, a business card, okay, and make it to the maximum zooming, as you see in the screen. Maximum zooming is better, and I just playing with the fine focus to look to the picture and to see that the picture is sharp. So now we have in the maximum magnification sharp image. Then I will go to the eyepiece. Look to the eyepiece. So in the eyepiece we have a diopters. Okay. So I just make the diopter to the 0, both eyes to the 0. Then I will close my left eye and I will look to inside the viewfinder. If I see a sharp image, no need to play with the diopter. If you feel, for example, something is wrong, or you find the picture is not sharp, just rotate the diopter to the right or to the left until you find the sharp image. Then leave it. Then jump to the next eye, which is the left one. Close the right eyes. Look also to the picture. If you find a sharp image, that's okay. If you are not finding, just play with the diopter to the right or left until you find the sharp image. Now the microscope is set. You just need play with the IPD regulator to make the same picture for your eyes. For example, my eyes is 44, 64, and I find two circles inside, and I can see one image sharp in the screen and in the object or in the viewfinder. So in this way, I am setting my microscope that I can capture a sharp image. What I see, I will capture in the screen.
So finally, I would like to say that the following slide that I discussed with you, you get benefit, and this is general information. I have more and more detail about that. If you want, you can follow my social media links and you see more information. Thank you very much for your listening.